right, we'll get started. All right. Thank you everyone for coming in here on a Saturday. Beautiful Saturday. Beautiful Saturday morning. All right, so my name is Jay. I am the founder of PhysioX. It is a nervous system-based physiotherapy clinic. The reason why I say that because I believe the nervous system pretty much governs how we move in a subconscious way, and that's pretty much how we function all the time. Like if we're sitting here, the posture that we hold ourselves in, the way we walk, we don't think about it. It's all happening subconsciously. So as it relates to kind of how we currently hold our position, we got to think about the past history of all the different traumas that we have gone through in the past. It's physical, it could be emotional, it could be anything. The body's going to find a way to hold a position that makes sense for us. So I would kind of go into an example of a physical condition that we might see. So let's say 10 years ago you injured your right ankle. You tripped, you fell. So what happens next? Well, your nervous system sits down and hosts like a meeting similar to like this. And they'll say, hey, look, ankle's in trouble. We have to not hurt it some more. So what we're gonna do, hip, I want you to go ahead and hike up a little bit. So it goes like this. Now the nervous system's job is to keep us upright, looking forward the whole time. So it's not gonna like this. So it's gonna tell ribcage, can you rotate a little bit this way? Okay, head, can you go back the other way? Okay, great. And then now you limp around like this for a couple of days until things start to recover, things start to feel better, and then you start to walk a little bit more normal again, but you might still hold on to a hint of that limp. And you will carry your position, your body, your posture in this kind of slightly off kilter type of way, and you would do everything in that shape. You might run in that shape, bike in that shape, squat in that shape, and you're gonna do some of these patterns and movement just a little bit differently. So when you squat, you might just go, whoop, skip a little bit over here and skip a little bit over here. And you don't notice it, but over time, ooh, the hip's starting to hurt. And you're like, okay, all right, I'm gonna do something for the hip. And what happens when another injury happens is the nervous system hosts another meeting and it goes, all right, hip's in trouble. Well, we gotta protect the hip a little bit. What are we gonna do? And the hip goes, yeah, man, I don't wanna do this anymore. I've been trying to do the job with this ankle for the last 3 years. I need a break. And so he pulls in one of the strongest players on the team, low back. He's like, low back, what can you do? He's like, yeah, I can do this. It's like, great, you do that. And then over the course of a couple of years of you doing more activities, your back's starting to hurt out of nowhere. You start waking up with back pain, back tightness, and you don't even know where it came from. And then you go to a physical therapist and they'll maybe do some work onto your back, give some stretches, maybe even strengthen your hip, and then you feel better. But after another couple of weeks, you go back to doing what you're doing and it just comes right back. And you're kind of stuck in this cycle because we're not really thinking deeper of what's actually the issue. Because we're addressing the symptom, but if that's because this ankle is still having some issues from that 10 years ago and everything has to compensate all the way through, we can't get anywhere with the back. And that issue will still keep coming around. So that's the general gist of what a nervous system-based approach philosophy looks like. It's more for chronic type injuries or chronic type pain and discomfort. Now, let's talk about posture and how can we change that now from that approach. All right, so we're gonna go into an example that's a little bit easier, which is just sitting at a desk. Now, who got desk jobs? Who? Oh yeah, I know you. So Jason's a videographer, very talented, so I know sometimes you're out there running with the camera, sometimes you're sitting down, right? Okay, so let's say you're sitting at a desk and you have like a mouse here, you have a keyboard here, you have a monitor here, and you have a monitor here, and then you see what happened over here? I shifted my posture in this way. My rib cage changed shape, and that's very important to understand because we're gonna be doing a lot of things to reshape that rib cage because that's what's gonna bring our posture back into alignment. So we're here, one part of the rib cage is a little more closed, one part of the rib cage is a little bit more open, and when we breathe, We don't breathe into one side, we breathe more into the other side. And we might be here for 6, 7, 8 hours. And then we stand up, and we're still gonna be a little bit like this, but the whole body's gonna be connected. If my posture is here, I'm not just gonna be here. One hip probably will have to drop a little bit, one head have to tilt a little bit to bring ourselves back into the center, because that's what the nervous system does. And how this will show up in your body will be maybe some neck pain, maybe some back tightness. It may not have anything to do with your rib cage. Most people don't come in and say, I have a rib cage problem. They come in and they have a hip problem, have a knee problem, have a back problem. But what we found is if we can shift the rib cage back into the middle, a lot of these other problems start to go away. A lot of these tightness start to go away. Because you think about muscles and why they get tight, they just attach to bones. If the bones are close together, the muscle is going to be more clenched in. If the bones are further apart, the muscle is going to be more pulled apart. But if we can find a way for the muscles to be somewhere in the middle, it's going to be pretty happy. All right? So breathing is something we're going to be doing a lot in this class because the breath changes the shape of the ribs. So if we're sitting like this all day and we're breathing and we're inhaling, exhaling through our chest, we're not getting any expansion through the backside of our body. These ribs, they don't open. And then you have all your low back muscles all attaching to these ribs, and they never get a chance to do this. They're gonna feel tight. And they're never gonna stop feeling tight until we start to make that area move. And when we think about breathing, we're moving that area from the inside out. The outside in would be, things that we're used to. Inside out is a breath. And the breath in the nervous system, close ties. In times when we're really stressed, especially around 2020, all the world's going to a different direction, we're shallow breathing, and we're stressed, we don't even breathe. Now these ribs don't have a chance to move around at all. And I've never seen so many people in pain since 2020. It's just everyone just seems to have problems. Physical problems just came out of nowhere. Okay. All right, so that is the nice introduction into the class. And what we're about to do next, we're gonna enter into that room and we're gonna practice different ways to breathe, practice different ways to move, and we're gonna check our flexibility before and after, check our pain levels before and after, and see what the body does if we just give it the right information, the right parts to move, okay? Everyone following along? That's anything seems confusing, now it's a good time to ask. All right, love it. Cool, you can bring that with you. Okay. Yeah, just keep it next to your mat. All right, everyone can follow me.